Tony Messenger filling in for McGraw today. We're talking with Senator Roy Blunt about mental health issues, and we were talking about the need for there to be more of a focus on mental health, not only in the military but also nationally. And one of the things I wanted to ask you, Senator, is that we've known about this for a while, and yet we've seen congressional funding for mental health services decrease. We've seen here in Missouri state funding for mental health services and the number of beds that are available for that sort of thing decrease for as long as I've been in the state covering that sort of an issue. Is there a change in the political will right now, both at your level in the Senate and hopefully at the state level, where we take a lot of federal pass-through money, to get a more serious focus on helping to deal with mental health as an important issue?
Well, I hope so. And, Missouri's generally been one of the leaders in mental health and mental health first aid and our mental health, the community mental health facilities and our federally qualified facilities, providing more behavioral services, a number of really pilot organizations in St. Louis that have the clubhouse model, lots of things that impact mental health in a positive way. But part of that, the hospital closing, the bed closing, as you suggested, has been, frankly, a studied effort on the part of the federal government over the last 30 years or so to encourage states to put people out of the hospital into the community, and the federal government would provide a little bit of so-called community support services because that was cheaper than keeping people in facilities. And facilities are not the best option most of the time, but some of the time they are the best option. So in our state, I'm not keeping up with that every single day, but the discussion of what to do with the state hospital at Fulton, which has long been in need of repair or replacement, looks like the legislature is going to do that. I'm hopeful that in the pilot project that we got for excellence in mental health, 8 states, certainly I'm going to do everything I can to encourage our state to continue to be a leader in this and be one of the 8 states that treats mental health at the clinic level like all other health for both the payment and treatment. And every veteran, the veterans groups, the law enforcement groups, the mental health advocacy groups, all were very supportive of the Excellence in Mental Health Act.
Speaking of health, one of the things that's been consistently in the political discussion over the last several years is the Affordable Care Act, and as I'm sure most of our listeners know, you've been consistently opposed to the Affordable Care Act, and yet you've been in a somewhat unique position in that after the act took place and people started signing up, you came out and said, hey, look, if you don't have health insurance, you should go to healthcare.gov and sign up, and you took some heat from the right for that. Another person taking the heat from the right is the former U.S. Senator from Missouri, who used to hold your seat, Senator Kit Bond, who's now lobbying for Medicaid expansion in the Missouri legislature. Do you have an opinion on whether or not the legislature should go ahead and take that federal money so that more people can get health care here in the state?
Well, one of my rules has been all the time I've been in the Congress that I wasn't going to give a lot of advice in Jefferson City until we'd solved all the problems in Washington, and we seem to be a long way from solving all the Washington problems. So I really don't have. I think this is a legitimately important issue for them to think about. You mentioned reducing mental health services, reducing education budgets. Whenever you increase one thing, unless people are willing to pay a lot more taxes, and you think and that's supposed somehow good for the economy, then you have to reduce spending other places. As Medicaid has grown, support for elementary and secondary education and higher education has either declined or stayed flat. So this money has to come from somewhere, and I think that's a legitimate discussion. I know Senator Bond's working hard on that, and legislators are looking at that. But there will be state money involved. Another thing that happens when you take the federal money to expand Medicaid is that people who previously qualified and hadn't signed up tend to sign up, and that's closer to a 50-50 match than the 90-10 match that the new people that are suddenly newly qualified would have. So it's a big decision, and this money has to come from somewhere, and legislators are going to have to answer when you and I say things like, well, what about the mental health funding? They're going to say, well, that actually went to the new Medicaid funding.
Has the tenor of the debate over the Affordable Care Act changed in Congress, where the House has been holding all of these votes to repeal, and yet now we've passed the first deadline. 7 million people have signed up, actually more than that. Kathleen Sebelius is no longer the head of Health and Human Services. Is the overall tenor of the debate changing, or are we stuck in this same sort of gridlock until the November elections later this year?
Well, I think the real question should be, is the Affordable Care Act what you would hope it to be? Is that the best way to get access for people to health care? I said when the website wouldn't work, hey, making the website work is not the test of whether the Affordable Care Act works or not. How many people sign up is also not the test. The test is, are you at the end of the day going to have more people or fewer people insured with insurance that works for them? And the new high deductibles, the businesses that between now and the end of the year who've always provided health care at work will stop doing that because the exchange is out there as one of the reasons not to do it. I think we wind up with fewer people insured 2 years from now than were insured 2 years ago. But the bigger question, I think, is...
But right now, all the studies say that that's not the case. Right now, all the numbers say that there are more people insured than there were previously.
I don't have any real confidence in the numbers, but it's not really an argument about the numbers. The argument is, or do they have better coverage than they had previously? And the new higher deductible policies, maybe the policies cover more things, but most of those you don't need. And so every week we have all kinds of people contact us with the deductibles. Hospital administrators around Missouri say that their fastest growing category of unpaid debt are people with insurance, because people that perhaps used to have a $500 deductible maybe now have a $3,000 deductible, or a $7,000 per individual in the family deductible is not unique in the system today. So was that really the best way to change this system? I think we need to have, if we had that debate today, as I've said on the Senate floor a couple of times, it would be a much better debate, because the Congress understands more of the consequences of what might happen, but so do the people we work for, and so do all the health care providers who are seeing the unintended consequences of what's happened in their world because of a government involvement in a place where the government used to let people make individual decisions. Now that decision is being made in too many cases by somebody else.
That's Senator Roy Blunt joining us in studio today on the McGraw-Milhaven Show. We've got to take a break. Thanks, Senator, for being here
Good
today.
to be here.
You're listening to the Big 550 KTR.